Hi everyone, this is 𝗪𝗫𝗀𝗀𝗃𝗀𝗃
and this is 𝗪𝗪𝗁𝗃𝗃𝗃.
So we are from Neethu's Academy. So we are here to do a role play demonstration for you guys, and we have picked one of the recent exam model cue cards as well. So Hannah, can you tell us more about what this card is?
In this card, you're able to see a 43-year-old patient who's recovering from abscess and ready for discharge, and the nurse is coming and giving him discharge instructions.
Exactly. So Hannah പറഞ്ഞതുപോലെ discharge instructions തരാൻ വേണ്ടി വരുന്ന ഒരു nurse ആണ്. So at that time, the patient is asking a lot of questions, and the patient is basically concerned about the continuation of antibiotic treatment, and he has his own reasons for that too,
Yes.
right? So ഈ ഒരു role play throughout നമ്മൾ കാണുന്നത് concerns ചോദിക്കുന്ന ഒരു പേഷ്യൻറ്റും അത് അഡ്രസ്സ് ചെയ്ത് അതിൻ്റെ സിഗ്നിഫിക്കൻസ് പറഞ്ഞു കൊടുക്കുന്ന ഒരു നഴ്സിൻ്റെ റോളും ആയിരിക്കും. സോ ഇവിടെ ഹാന ആയിരിക്കും പേഷ്യൻ്റെ പാർട്ട് എനാക്ട് ചെയ്യുന്നത്, ആൻഡ് ഐ ടേക്ക് പാർട്ട് ഓഫ് ദി നഴ്സ്. സോ ലെറ്റ്സ് സീ ഹൗ ദിസ് റോൾ പ്ലേ വിൽ ബി.
This is your role play card, and you'll have 3 minutes to prepare, and your preparation time starts now. Your preparation time is over.
All right, may I know the name of the patient, please?
Hannah.
All right.
Okay, now you'll have 5 minutes to speak. So your time starts now.
Good morning, Hannah.
Good morning.
My name is 𝗪𝗪𝗁𝗃𝗀𝗃. I'm one of the registered nurses working in this hospital. I'm here to provide discharge instructions to you. So before we proceed further, I need to check with you how you have been feeling right now, and also I would like to know whether you are satisfied with your recovery progress.
Actually, I'm feeling much better now, and I'm ready to go home.
That's very good, and I'm very glad to hear that too. So without wasting much time, shall we proceed with the discussion of post-discharge care? Is that okay with you?
Yes, sure.
Alright, so Hannah, I would like to start with the wound care. So it is very important that you take care of the wound. You understand that you've been here for the treatment for abscess and you're recovering quite well as well. But please make sure that you take really good care of the wound. So please ensure to keep it dry and clean. And you need to always look out for any signs of infection as well. Okay, so that is the first and foremost thing you have to do. Is that clear to you?
Yes, it is.
So along with this, it is equally important that you have a well-balanced diet and to increase your fluid intake. This actually plays as a very good aid for your recovery, so please make sure that you follow these. Okay. All right. Speaking of your antibiotic treatment, please continue the antibiotic treatment as prescribed by the doctor. Even if you start to feel better and if you feel like I don't have to continue it, please don't make the decision to stop the course. Please make sure that you complete the entire course of it. Okay. It is very important. I hope you understand that.
Yes, I do.
Okay. So along with this, I would like to tell you more details about how it is important for you to check out for any signs of infection, and please make sure that you come for the follow-up appointment as suggested as well, because we need to evaluate your progress and we need to ensure everything is going as planned too. Okay? So I hope everything is clear to you. Would you like to ask me anything?
Should I take the antibiotics even if I'm feeling better?
Well, that's quite a good question, and I understand that you are a little concerned about continuing the antibiotic treatment because from your perspective you feel like you're feeling much better right now, and what is the role of this? So let me tell you what are the benefits of this. All right, so the antibiotic treatment that's been prescribed to you, it helps to prevent the spread and the recurrence of infection. It also helps in your recovery too. That is the reason why we suggest you to continue the antibiotic treatment. So could you tell me what exactly is bothering you related to the antibiotic treatment?
I'm worried about the side effects.
I totally understand you're concerned about the side effects, but let me assure you that you need not worry about it because you have been taking these antibiotics for a few days right now and you don't have any side effects so far. And even if you experience any of the side effects, don't worry about it. It's quite easily managed. Okay, we can manage it. Okay. And also, this will not prolong for a very long time. You do not have to worry too much about it. Okay. So I hope you understood every point. So do you have any other concerns to ask me?
No.
All right. So before I leave, I would like to tell you one more thing. It is important that you take the antibiotics because if you stop taking it, there is a possibility it might worsen your infection. Then we will need to perform invasive procedures, and sometimes there can be more complications too. So to avoid all these things, the best thing to do is to continue the antibiotic treatment. All right. So Hannah, since you're clear with everything, I hope you're ready to continue with your antibiotic treatment.
Yes, I am.
Thank you for your cooperation, Hannah. So I hope everything is clear to you. If you need anything, please ring the buzzer and I'll be there to help you. And I'll be coming back to check your progress later on.
Okay.
Thank you for your time.
Okay. Your 5 minutes is over.
Alright, so that's the end of this role play and we hope that it was clear to you guys. So Hannah, what do you think about this role play?
In these type of role play cards, you'll have to reassure the patient and make them understand the significance of certain things.
Exactly. So in this card also, we can see the patient is asking a lot of questions. Why? Why should I take this antibiotic even after I'm feeling better? So in the cases of Varumbo, you have to provide a lot of reassurance. തന്നിരിക്കുന്ന ടാസ്കുകൾ മാത്രം ഒരു സെന്റൻസ് ആക്കി കൺസ്ട്രക്ട് ചെയ്ത് പറയുന്നതായിരിക്കില്ല നിങ്ങളുടെ കോൺവെർസേഷൻ ആയിട്ട് വരുന്നത്. അതിന് വേണ്ടുന്ന സ്യൂട്ടബിൾ ആയിട്ടുള്ള അക്നോളജ്മെന്റ് സ്റ്റേറ്റ്മെന്റ്സ്, ആ ഒരു ടാസ്ക് കേൾക്കുമ്പോൾ പേഷ്യൻറ്റിന് ഉണ്ടാവുന്ന ഒരു ഇമോഷണൽ ഇമ്പാക്റ്റിനെ ഒന്ന് കൺസോൾ ചെയ്യുന്ന രീതിയിൽ അല്ലെങ്കിൽ ഒന്ന് സോഫ്റ്റൻ ചെയ്യുന്ന രീതിയിലുള്ള ഒരു ചെറിയൊരു റീഅഷ്യൂറിംഗ് സ്റ്റേറ്റ്മെന്റ്, ഇങ്ങനെ കുറേ സ്റ്റേറ്റ്മെന്റ്സിൻ്റെ ഒരു ക്ലബാണ് അല്ലെങ്കിൽ ഒരു കൊളാബറേഷൻ ആണ് നമ്മുടെ എൻറ്റയർ ടാസ്ക് പ്രസൻറ്റേഷൻ എന്ന് പറയുന്നത്. സോ ഓൾവേസ് മേക്ക് ഷുവർ യു ആർ മോർ പേഷ്യൻറ്റ് സെൻട്രിക് വെൻ യു ആർ ഡൂയിങ് കാർഡ്സ് ലൈക്ക് ദിസ് ആൻഡ് പ്രാക്ടീസ് മോർ കാർഡ്സ് ലൈക്ക് ദീസ് ടു. സോ ഞങ്ങൾ ഇതിൻ്റെ ബിഗിനിങ്ങിൽ പറഞ്ഞതുപോലെ ഇതൊരു റീസെൻറ്റ് എക്സാം മോഡൽ ക്യൂ കാർഡാണ്. സോ നിങ്ങൾക്ക് ഇതുപോലത്തെ കാർഡ്സ് പ്രാക്ടീസ് ചെയ്യുന്ന രീതിയിൽ when you do this, it actually builds your confidence to examine പോകുമ്പോഴും കുറച്ചുകൂടെ ബെറ്റർ ആയിരിക്കും നിങ്ങളുടെ പെർഫോമൻസ് സൈഡിലേക്ക് നോക്കുമ്പോൾ. So always make sure that you practice cards like these. So we hope this was helpful to you guys. If yes, let us know in the comment section. So Hannah and I will be back with another role play very soon. Until then, take care. Bye-bye.
Bye.